Understanding and managing hip osteoarthritis, a chiropractor's perspective. As a chiropractor, I see many patients who are struggling with hip pain and stiffness. Often the culprit behind these symptoms is hip osteoarthritis, or OA, a condition that affects millions of people worldwide. In this post, I'll explain what hip OA is, how it develops, and most importantly, what you can do to manage your symptoms and improve your quality of life. What is hip osteoarthritis? Hip osteoarthritis is a degenerative condition that occurs when the cartilage in your hip joint begins to break down. Cartilage is a tough, flexible tissue that covers the ends of your bones and allows them to glide smoothly against each other. When this cartilage wears away, the bones in your hip joint can start to rub together, causing pain, stiffness, and inflammation. Risk factors for hip osteoarthritis. Several factors can increase your risk of developing hip OA, including age. The risk of hip OA increases as you get older. Gender. Men are slightly more likely to develop hip OA than women. Genetics. Some people may be more prone to hip OA due to inherited factors. Obesity. Carrying extra weight puts additional stress on your hip joints. Repetitive stress. Occupations or activities that involve prolonged standing or heavy physical labor can increase your risk of hip OA. Signs and symptoms of hip osteoarthritis. The most common signs and symptoms of hip OA include pain in the groin, thigh, or buttock area, stiffness in the hip joint, especially after sitting for long periods first thing in the morning, difficulty putting on socks, shoes, or climbing stairs, a grating or crunching sensation in the hip joint, decreased range of motion of the hip. If you're experiencing any of these symptoms, it's important to see a healthcare provider who can perform a thorough evaluation and determine if hip OA is the cause. Diagnosing hip osteoarthritis. To diagnose hip OA, your chiropractor or other healthcare provider will start by taking a detailed medical history and performing a physical exam. They may check for tenderness around your hip, assess your range of motion, and perform special tests to help identify the source of your pain. In some cases, imaging tests like X-rays or MRI may be necessary to confirm the diagnosis and rule out other potential causes of your symptoms. X-rays can show changes in the bone and joint space that are characteristic of osteoarthritis, while MRI can provide a more detailed look at the soft tissues surrounding your hip joint. Managing hip osteoarthritis with chiropractic care. While there's no cure for hip osteoarthritis, there are many things you can do to manage your symptoms and improve your overall function. As a chiropractor, I take a comprehensive approach to treating hip osteoarthritis that includes a combination of manual therapy, exercises, and lifestyle modifications. Chiropractic adjustments and manual therapy. One of the most effective treatments for hip osteoarthritis is chiropractic manipulation, also known as adjustments. By gently mobilizing the joints in your hip, pelvis, and low back, we can help restore normal motion, reduce pain and stiffness, and improve overall function. Several studies have shown that chiropractic manipulation can be more effective than exercise alone for reducing pain and improving range of motion in people with hip osteoarthritis. Exercise and stretching. In addition to manual therapy, exercise is a crucial component of managing hip osteoarthritis. Engaging in regular, low-impact activities like swimming, cycling, or walking can help improve joint mobility, strengthen the muscles surrounding your hip, and reduce pain and stiffness. Your chiropractor can teach you specific stretches to target tight muscles in your hips, thighs, and buttocks. Lifestyle modifications. Making some simple changes to your daily routine can also help manage your osteoarthritis symptoms. These may include managing a healthy weight to reduce stress on your hip joints, using a cane or other assistive device to take pressure off your affected hip, avoiding activities that involve prolonged standing or repetitive stress on your hips. Apply heat or ice to your hips to reduce pain and inflammation. Taking over-the-counter medications or supplements like glucosamine and chondroitin as directed by your healthcare provider. When to seek additional treatment. While chiropractic care can be highly effective for managing hip osteoarthritis, there may be times when additional treatment is necessary. If your symptoms are severe or not responding to conservative care, your chiropractor may recommend seeing an orthopedic specialist or other healthcare provider for further evaluation and treatment. In some cases, more invasive procedures like joint injections or hip replacement surgery may be necessary to alleviate your pain and improve your function. The bottom line: if you are struggling with hip pain and stiffness, know that you are not alone. Hip osteoarthritis is a common condition that can have a significant impact on your quality of life. But with the right combination of chiropractic care, exercise, and lifestyle modifications, it is possible to manage your symptoms and continue doing the activities you love. If you're in my area and looking for a chiropractor who can help you navigate your hip osteoarthritis journey, don't hesitate to reach out. I'm here to help every step of the way.